Good evening. Good evening. Thank you so much for joining us this evening. I think this is our fifth, our fifth town hall. I had to think about it. And I just want to make sure all of our key players are in the room. And I'm going to make, okay, I see Katie. Is Miriam here? Let's see if Miriam is here. And then we have a couple of team members that'll be joining us a little later on. So why can't I see? Here we go, participants. Let's see, I don't see. All right, I don't see Miriam yet, but I'm sure she will join us shortly. All right, so what we'll go ahead and do is do some housekeeping. Again, thank you for joining us today. If I know it is 6 o'clock and hopefully you have all the information that you need as far as just trying to make sure you're easing out of the day as you're ending your day with us here at DMAS and VDSS. And so hopefully you'll get good information and hopefully you'll have lots of questions to ask and make sure that you have clarity. All right, so before we get started, you will see two features. I'll have all of us introduce ourselves, all our speakers introduce ourselves. And the features at the bottom, you'll see two things. You'll have chat and then you'll have Q&A. If only you see the chat, you can click on the three dots, the bubble with the little, like, here's a side bubble for speaking. That's the chat feature. And we're only wanting those for like clarity and discussion. If you have a question in of itself, we are asking that you actually submit those questions via the Q&A. And if you click the three additional dots that sit to the left, to the right of that, you'll see a Q&A feature. Just click on that feature and then submit your question there. So we can just make sure we keep up with it and we know when we're answering those questions appropriately. Let me see if I see Miriam and see if she's joined us. All right, I don't see her quite yet. And in meantime, I'm going to have Katie go ahead and introduce herself, and then I'll introduce myself and see where we go from there.
Good evening. My name is Katie O'Connell Raymond. I'm a Medicaid consultant with the Virginia Department of Social Services.
All right. So I am Natalie Pennywell. I'm the Outreach and Community Engagement Manager here at DMAS. And we have normally a third team member, which is Miriam Siddiqui. And I don't see her quite yet. So I will start it off and then hopefully she'll be able to join us and then take it from there. All right, so we'll go from there. Me and Katie always know we can pivot as we need to, and we'll just keep rolling. All right, so and behind the scenes, I want to make sure I thank our team. That includes Rebecca Dooley. I don't know how many of her team members are here, but sometimes that's Kristen, sometimes there's Anita, and then we have Dahlia that's helping to post anything regarding the closed captioning, and then any other team members that are going to be helping with the Q&A. We thank you in advance for your time. So let's go ahead and get started. Thanks, Rebecca. I jumped the gun there. Next slide, and then next slide. All right, so why are we here today? The purpose is to make sure that we provide information for you. As you well know, for the last 3 years, we have been in this space, this holding pattern, for making sure we don't that we have continuous coverage for our members. Our current guidance and federal partners have given us additional guidance regarding what that looks like for us. And as we move forward and make sure there's clarity for that, we're trying to make sure that you have all the information you need in order to be successful in your endeavors while supporting our members. We've received funding for the last 3 years, and there's going to be a step down to that funding over the next 12 months. And then we also want to make sure that as we're transitioning to this back to normal state, because this is something that existed before the pandemic, right? This component of the work existed before the pandemic. And so we're trying to get back to that state of renewals every single year on an annual basis. But we first have to do that for all the people that have been placed on hold for the last 3 years. And DMAS and VDSS is collaborating with stakeholders all across the continuum of care, right? All across Commonwealth in order to make sure that our sister agencies, health plans, advocates, any assisters that may exist, community partners, providers, that our community members in general understand that this is to be a smooth smooth transition. And we're hoping that by giving you this information, giving you a forum and an opportunity to kind of talk and discuss, learn about what the process is going to look like, that you'll feel more confident in the support that you provide. Next slide, please. Thank you so much, Rebecca. All right, so in this space, what have we done so far? What have all of our planning efforts entailed? And we have done a lot. Between DSS and DMAS and some of the other people that sit within the Virginia Medicaid ecosystem, as I like to say, there's a lot of work that has been done. And when we start to look at this continuous coverage requirement and all the things, all the strides that have been made in order to make sure that we're best prepared for this process as it ensues starting in a couple of weeks now, we just want to highlight some of the things that have been done. We've made some system updates. We included improving efficiency when it comes to the renewal/redetermination process. We hope that this, by creating these efficiencies, we will reduce the number of individuals that are inappropriately terminated, right? And so when we talk about some of those administrative reasons that take place, trying to decrease that as much as possible is really the goal. Developing a detailed plan to stage redetermination. And I will say Jessica Iannacini, the eligibility and enrollment team, Cindy, all of them have been working feverishly in order to make sure that we have a schedule, that everybody understands what that caseload looks like as it's spread across the 12 months, because we don't want to be too heavy one place and too light in another. So making sure that there's detailed plans and there's stagings of these redeterminations over the next 12 months is also important in order for our systems to also operate in the most efficient and effective manner. Collaborating with our managed care organizations, they have been fantastic and phenomenal in a lot of different ways, receptive in a lot of ways, asked wonderful questions, allow for us to really think through how can we best support our members through our MCOs, and then giving us firsthand knowledge of what that experience may look like for them as they're doing that support, and how we can better engage them to make sure they have a firm understanding of what that looks like and what those processes look like. Addressing returned mail. We often talk about what it means when people do not receive the information that they need. And for our two agencies that send out a lot of mail, we definitely need an approach to make sure that we understand what happens when returned mail is taking place. Cindy's team has done a tremendous job. And I see Victor Grand here today, I believe, and he sits a part of that team that understands when there's return mail that something needs to take place. We have a lot of strategies in place and teams in place in order to make sure that when they receive that information, they can follow up on those members in order to try to get to a correct address so that they can receive what they need to receive. Communications outreach and engagement plan is in place. We have a lot of digital outreach and engagement. We've been doing a lot of work in reinforcements, application assistance to ensure our members understand the steps that need to be taken in order for them to successfully maintain coverage if eligible. And then also making sure you as stakeholders understand what those processes are as well. And then we have our coordination of language approval and schedule delivering of our mailings, digital, telephonic outreach, any kind of way in which we can make sure, like we said before, that this process is easily understood and that you understand what place you hold in the process in and of itself, and give you a forum to ask questions to gain clarity. We're trying our very best to create those materials and tools for you. And then identifying which federal flexibilities that the Commonwealth will maintain, because as you know, with the pandemic came a lot of opportunities for us to see different ways in which to do some of the work that was being done previous to the pandemic. And so looking at how new strategies that the department can, they may take to leverage some of those flexibilities in what way in order for it to truly benefit the member overall. Next slide, please. Thank you. All right, so the CMS guidance truly reiterates that states' obligation to respect the conducting full redeterminations, providing enrollees ample time to respond is truly important. For us, we have to go through a process, and we can't just touch that member one time if they don't respond. There's methods in order for us to do this kind of work. Make sure that the renewal process in of itself is clear to the members and of itself. We have 12 months in which to do this work. The major takeaway for this slide is understanding that this is a staggered approach. Not everybody's going to be redetermined at the same time. There's certain processes that are in place and certain time frames that are in place in order for our members to return the information necessary in order to maintain coverage if eligible. And then make sure we elevate any issues or concerns that come up and make sure that everybody that is a part of the process, all the way from sending out the first ex parte through appeals, make sure that they're plugged into the process so our members get the best possible customer care. And then making sure we don't take adverse action before CMS has provided us guidance to do so. And in their guidance that was laid out through the omnibus bill, they allowed for states to start that process in April. So we can start the process actually in February in time. And so we're going to start that for Virginia this month. We're going to start ex parte, which is a no-touch process, and that'll go through, but no adverse action will be taken before April 30th of 2023. So that's also truly important to know. Next slide, please. So this is the timeline, all right? This is what this looks like. Full renewal processing starts this month in another week or so. And for us, first closures won't happen before April 30th of 2023. So April will be the first month that it actually happens. Have 12 months in which to do this kind of work. Make sure we have a sustainable caseload across those different staff and team members. And you'll hear Katie talk about that a little bit more, about all the things that are being done in order to make sure our workforce is prepared and trained for what's coming their way. And then they'll have 2 months to do a little bit of cleanup based on when that last redetermination packet is sent out. And so this is what we're looking at. This is what this process looks like for us. This is what this timeline looks like for us. So I'm going to turn it back over to Katie, and she's going to kind of explain some of the components that VDSS is over, and then you'll come back to me and we'll talk about what that outreach, engagement, and communications plan looks like. Thanks, Katie.
All right. Next slide, please. So, well, we could go back if you like. Thank you. I haven't done this slide, but I will.
That's because it's my slide. I completely forgot.
You're
Well,
getting
not
excited.
typically my slide, but it is our slide. I'll review it right quick, Katie. I apologize. I'm a little off this evening. So the last thing is to highlight all the different ways in which we have worked in order to make sure that we can renew and resume our normal operations. We have done system updates. We have waivers, temporary and unwinding waivers that have been submitted and approved. We have trainings that are being done, policy flexibilities in place. We have had a plethora of different stakeholder and member outreach and engagement and communications done. And so all of these different components really sum up the way in which we have been preparing for the last 3 years. And this is a great foundational slide for handing over to Katie in a normal circumstance. And I completely forgot, so I apologize for that, Katie.
Next slide, please. All right. So we are going to talk a little bit about what we've done on the VDSS side with DMAS, various methods of communications to our customers, to internal sources, and our external entities. So we have been working with some joint broadcast messaging where, in conjunction with DMAS, we've been sending out the same messages. They read everything that we've done. We go back and forth to make sure that we're on the same page. And so we have pretty consistent messages that go out to the local agencies regarding the unwinding and what's going to be affected. In conjunction with that, that's my favorite word this evening, apparently. We've been having joint monthly unwinding virtual meetings. We're having one actually next week, and that's for all the local agencies to talk about the unwinding process. And part of that is pointing them in the direction of different resources, scripts, unwinding toolkits, different things so they can be prepared for what is getting ready to occur. Because if you think about it, no reviews in 3 years, you have staff that have never done reviews. This is going to be an undertaking. So they need to have resources that are available to them. And we've been putting together and jointly with DMAS list of frequently asked questions of what they can expect, scripts so when people call, that they're ready for those calls and can direct them to the right resource. We have also been putting together with DMAS unwinding guidance and advice of what steps that the individual or person needs to take to do the redetermination, to clean up and prepare and develop some best practices. So a lot of that's going on right now. And then what can they do once we start renewals? And then also VDSS has an unwinding portal that's sort of a one-stop shop that's on our intranet. And they've got an important message. We've got notes going back to the past 3 years of FAQs and best practices, different presentations, recordings, anything they could want is right there. I actually was referencing it the other evening and looking back on notes from 2021. So it's a good tool and it's out there for our internal staff. Next slide, please. So on the public side, we've also been trying to prepare everybody for the unwinding. So we've undertaken with DMAS some social media messaging on different social platforms like Facebook and Twitter. And I have seen those things out there myself. Nobody ever wants to enter into conversation with me because I'll tell them about it. But we've also got the portal where people can apply for almost every kind of assistance except for auxiliary grant, Common Help, and you have the web address right there. There's a public facing message there with some important information about the public health emergency and unwinding, and that's been there since November 22. And then on our public website, which is pretty easy to remember, the www.dss.virginia.gov, there's messaging there and important tools there for the public regarding the unwinding and the resources that are available to them. And so with that, we've been working with DMAS to issue joint press release. And so that's almost ready for public viewing and will be out shortly. And then we've been partnering with the Virginia Association of Free and Charitable Clinics. And we have to address, if someone does not complete their renewal, perhaps they aren't eligible for assistance any longer because they're over the income limits and they need to have tools that are available to just refer people to those. A good resource is the freeclinicscare.org address you see right there that has a plethora of resources for individuals that need assistance with healthcare out in the community. So if someone is no longer eligible for Medicaid, then they can go there. I think they'll talk a little bit later about the referrals to the healthcare marketplace that occur, but there are tools out there to address this when it occurs. Next slide, please. And so this is a flyer that we've been working on, and I'm just focused on the orange column because we're talking about medical assistance. And if you go to the very bottom of that, you'll see an address on the internet, the dss.virginia.gov/benefit changes that you can go to, and there are resources there regarding the unwinding, different toolkits and things are available. I'd also like to mention, and it'll get mentioned later on, go to the Cover Virginia website. They have excellent toolkits, resources for individuals and providers that you can help prepare people. I can't say enough about the website. It's very helpful. I always refer to it when I'm looking for something. Next slide, please. And just to let you know a little bit about what we've been doing internally. I say internally, but I'm talking about regionally and statewide. We've been providing trainings for staff regarding how to do redeterminations, but we've also done a lot of training for them just on the Medicaid program. Agencies have seen a high turnover, so you have a lot of new staff, and so they've done program training, but we've especially put on this redetermination or renewal training for them, one targeted to new workers, one targeted to more seasoned workers. And then we've been doing subject matter expert webinars where we're providing them an opportunity to interact with the regional consultants and the home office consultants and staff from DMAS regarding questions they might have about the renewal process and what to expect. Because remember, we haven't done them in 3 years. And if you don't do it, sometimes you forget how to do it. So we're trying to make sure they're up to date on policy, procedures, and as things come through, we're trying to make them aware of it because they've done a lot of changes to the system. A lot of things have been updated and streamlined to make this easier, not only for the individuals that are having to complete the renewal, but also the staff that are trying to process them. And so that just gives you some of the different things that we've done internally to help prepare people. Definitely, we've got something that we worked on with DMAS that is procedural guidance and awareness of what's going on, because this is going to be a big undertaking and we all need to work together. And I believe that is my last slide, and I will turn it back to Natalie.
Really, Katie can keep up with her slides. All right, so outreach, engagement, and communications. So now you understand all of the context for where we are. Let's talk about some of the tools and resources at your disposal for use while you're navigating this process. And so we have 3 phases when it comes to outreach, engagement, and communications. We have phase 1 that has updating contact information, phase 2, which is completing the renewal process, and then phase 3, which is what happens if you have lost coverage. What are your next steps? How can you be reconsidered or redirected as necessary? So let's go to the next slide. Thanks, Rebecca. So in this one, you'll see that we are starchly in phase 1. We started this at the beginning of 2022. We created resources and tools, and we're going to review a couple of those resources so that you'll be familiar and aware about using those. But the first phase really is encouraging the updated information. We'll say that you'll hear any partner that is in this spectrum, right, that is doing this kind of work, reinforce the absolute need for updated contact information, because we can't effectively do 2 and 3 if we do not have updated contact information. So you'll see that phase be pervasive throughout the entire time period, because we need it first, right? We need that to take place, and we need all of you in order to do that successfully. The second one is making sure they actually complete the necessary paperwork sent to them. And when we get into questions and some of the things that have come up, some questions have been around, like, what is the process? When they're going to receive this information? How long will they have in order to actually completed? And we'll get into some of those answers, but it's really important that in that process, once they've actually received that, for those who don't successfully complete ex parte, we want to make sure that they understand that they need to give it back to us. They have to return it back to the resource, to the source in which they received it from, and making sure that they complete it, that they have the support and the mechanisms in place to do that. We have done, I will say, VDSS, DSS, LDSS, MCOs, all of the different components of everyone is really helping and supporting to make sure that our members have access to the resources needed in order to do this successfully. And then you get into phase 3. Phase 3 is really about encouraging those who have lost coverage for any administrative reason to, again, do the thing that wasn't done in phase 2, or to make sure if they've had, a wonderful life event, they've had a change in their income for the better, they've had a promotion, different things have happened, that, hey, over 3 years, a lot of things can change, and sometimes they change for the better, and you are no longer in need of Medicaid. How can we make sure that we redirect you to the resources that you have at your disposal in order to maintain coverage of whatever kind that you would like, since you no longer are eligible for Medicaid in of itself? Next slide. So what have we done so far? What are some of the things that have taken place as far as the outreach, engagement, and communication spectrum? And when you talk about members and partners, some of them are similar, and then some of them have been different. For our members, we have created and made sure that our partners have access to digital ad campaigns, as well as them directly having some digital ads exposed to them in different modalities. Social media campaigns, Cover Virginia websites have been updated, and then the VDSS, as well as our main DMAS website, have been updated and redirects to Cover Virginia, because that's where we house the majority of our member-facing documents and information. Toolkits have been created for providers, partners, stakeholders, as well as our members, in order for them to understand how they can receive information, what particular materials are at they can actually have access to. We've mailed member flyers and posters to LDSS local Department of Social Services offices, as well as our community service boards. We plan on doing the same for phase 2 and 3 materials once they're available. Translated documents into 6 additional languages outside of English. And that is just to make sure that as people would like to receive this information, it's easy for them to actually do so. We continue to work with other partners, and if you find that there's something or a language that we have not translated to, and it's a great need, have a conversation with us. But we always have additional resources through Cover Virginia that can also address that need as well. Providers have been given memos, informed our health plans, worked with our health plans to better understand what their needs are. We've also held virtual meetings and in-person meetings with partners, with navigators, organizations, sister agencies. We've done these things, as well as we've hosted these town halls, right, to order to make sure that we're having a conversation about what this process looks like, that we understand what questions we're receiving, that we give you answers to the best of our ability, or we make sure we have pathways to resources or additional subject matter experts so you can get them addressed. Next slide, please. So our toolkits looks like this. All right, so you have the phase 1 toolkit, which you have the orange bar, and then you have the phase green, the phase 2 and 3 toolkit, which has a green bar. And you can find this on the Cover Virginia website. We just went through a refresh this weekend. It looks quite beautiful. It's very much in line with the suite of websites that we have here at DMAS. And on that website, you'll see at the top right-hand corner a return to normal enrollment link. You're going to click on that link. It's going to take you to a web page that talks about all things unwinding and return to normal renewal processes. And then you're going to, on that same page to the right-hand side, you'll see a link that says toolkits and materials. And we want you to also click on that as well. And that, when you click on that, you'll see the phase 1 toolkits at the top for just general stakeholders and MCOs. And then you have all of the different individualized materials that exist within that toolkit broken out right under it. And then you'll see phase 2, and the same thing, the same pattern is follows that. And then you'll see digital assets towards the bottom. So we want you to make sure you navigate to that page, if not tonight, tomorrow, so you get familiar with it and you understand where you can find your resources. Next slide. Some examples of what exists in our phase 2 and 3 toolkit, because we really want to highlight, because we're in that season of now, is making sure you understand we also created something that helped to visualize what that process will look like. We thought it was very important to make sure people understand what is the responsibility of Virginia Medicaid. And Virginia Medicaid includes all of us that support this system within the under the umbrella of Virginia Medicaid. And then what is the member's responsibility? This is a great visualization. It simplifies the process for our members and our stakeholders. We understand that it has some complexities in it, but for the most part, we want you to understand that when this takes place thereafter. Or if you are sitting there and you're thinking, why haven't I heard back? Are you waiting for something? Or better yet, are we waiting on something from a member? So understanding what that process looked like is really, really important. You also have 2 subsequent materials and documents that go along with this that kind of spells this out in a written format, step by steps, and then sometimes truncates that information a little bit more. So that's also attached to this document and available. Next slide, you'll see examples of what our flyers and posters look like. As we start to go through all of those different components, you really want to be able to pull a document and really walk through, if you would like, with the member. What is it that's being expected of you? What are you waiting for? What should you know? And when we say 12 months, because not everybody's going to go through a renewal process at the same time, it's important that they know if you have updated your contact information and you're just waiting to hear from Virginia Medicaid, what does that process look like? What are those expectations once you actually receive that renewal packet, if you receive one? And then what can you do? How can you be proactive about making sure you check those things? Posters are the same, and make sure they have that information. And these are the 6 other languages that we translate our member-facing documents into, just for readily available use. Next slide, please. So we have gone through town halls, and I need to check off the 3 that we've done in the last 2 days. And so we completed the housing town hall yesterday, as well as the housing the advocates and community leaders. And then this evening, we're hosting the home health associations. And then next week on Monday, we have two. We have nursing facilities during the day, and then we have a general one that's just open to any and everybody in the stakeholder family that would like to join us and learn a little bit more, ask some questions if they haven't already been answered. We also have on our website, if you scan the QR code, it'll take you directly to the DMAS website and town hall page, where you will see that the recordings from, I know at least last week, have already been posted, and the ones from this week should be posted before the beginning of next week. We want you to go there, listen. If you're joining multiple one of these, which we also encourage, it is always good to listen to see if a question that you had was already previously answered. And if it was, yay. But if you also listen through them and you find that it's a couple of questions that weren't answered, then attending one at a later date is also healthy. I mean, not healthy, is helpful in order to understand how you can make sure you get all the information that's necessary. We also find that at these town halls, just understanding and seeing your community, right? So when we have these different stakeholder groups, we look at it and say, oh, you have the home health associations, they're all here, they have similar questions, they're thinking along the same stream of thought. And so sometimes pooling those questions have been really, really helpful for some of those stakeholder groups. I will tell you that the medical providers and Medicaid advocates found it to be tremendously useful. The housing one that we had yesterday was a really good one that had some really very poignant and specific questions to the housing community and how this process is going to affect them. So we're hoping tonight, as home health associations, you'll also provide some questions that will be really helpful to you as an overall group. Next slide. So what are we asking for? What are the takeaways? How can we use your support? Really, first and foremost, you have to remember that Medicaid renewals begin this month. It is not something that is off in the ether somewhere. It's not something that's happening down the line. It is happening this month. So that means that some members will start to receive paper renewal packets in the mail. And when they receive them, I'm going to drop down to how you can support Virginia Medicaid and say that we need to make sure that they are actually completing those packets, that you have the support that you need in order to do that. And you understand where those support mechanisms exist. Like we have the Virginia Healthcare Foundation that offers Project Connect outreach workers that do nothing but support our members navigate through packets. And so they're there, they're available. We want you to utilize some of those resources, and they're highlighted in our toolkit as well. This is a 12-month process, right? Not everybody's going to go through this all this month. Oh my goodness, could you imagine? Our systems would implode on itself. But we want to make sure you understand that this is going to be a staggered approach. And since everybody won't be redetermined at the same time, updating, again, dropping back down to how you can support the Virginia Medicaid system, making sure they update their contact information will ensure in this staggered approach that as they're waiting to receive their information, they actually do receive it. Kate is going to give you some really key points about what it means once it is in the mail and of itself. And then for us, also making sure you circle back to us, provide the feedback to let us know, is this useful? Is this something that you're finding is tremendously helpful in your process of understanding and support, but also in our members' process of receiving that support? We want to better support you as you support them, because at the end of the day, they're the most important factor in all of this entire process. Next slide. So again, we wanted to highlight for you, how can you renew your Medicaid coverage? How can they go through the process? How can they renew that Medicaid coverage? And if we have some community members on, this is directly pointed towards you. First one is called the Cover Virginia Call Center. Our teams have done a tremendous job of making sure this call center is both staffed and have all the support that you need. They can answer questions, they can walk you through. They are a tremendous asset. So please, the first step that we have in place is call Cover Virginia. The second one is Common Help. If you want more information about what's going on yourself, log into Common Help, kind of go through the system. Now, if you need additional information about how to access your Common Help application and other thing, I'm going to leave that to Katie to explain in our question and answers component. But that's the next thing that we need to do. The last thing that we offer is in person, making sure you visit your local Department of Social Services. This is Natalie speaking, because I do outreach and engagement and I have a soft spot for all of our staff and our team members. I'll always say, if you're going to go that route, right, if you're going to be approaching our staff and our team members at BDSS, please do so with grace and mercy. This is a new process for all of them. And as they're learning, they're going through trainings, they're trying to make sure they manage everything. They're trying to give the best possible customer service to all of our our members. And we often say they can be kind when they're met with kindness and understanding. And so we want to make sure as you're navigating that particular component that you do so with a little bit of grace, mercy, and understanding. And then you circle back at the appropriate times, the appropriate avenues if you're finding that you're having any issues, and Katie can definitely address what that may look like for some of our team members as they're going through this process and those staffing levels. But those are the 3 ways in which you can go through the process of actually renewing the Medicaid coverage. We also encourage and invite you to visit Cover Virginia often. There's a plethora of different information there. There's lots of different things to support understanding and navigating through the process. There also is avenues for getting in contact with subject matter experts that also can take you, give you a lot more in-depth context for what you're looking for if necessary. And then the last slide is just appreciation and thank you for all the work. We have a lot of partners that are in this this Virginia Medicaid ecosystem, and we want to thank not only them but you for helping with that. We're going to open this up at this time and invite our subject matter experts to come on camera and come off mute so they can introduce themselves. So as we start to jump into these questions that you all have either submitted now or before, that we can do that. I know I see a couple. Victor, if you can come off mute and if you can on camera to introduce yourself and your role in your agency.
Yeah, I'm Vic Grant. I'm Senior Policy Analyst at Department of Medical Assistance Services, and I support the eligibility and enrollment systems.
Thank you. And I think I saw Tia. Is Tia on? And I think I see Nicole Martin.
I am Natalie. My camera's not functioning properly right now.
You're
but
fine.
Good afternoon. My name is Tia Lewis. I am the Division Director for Program Operations. So basically provider and member services is what my group focuses on.
Okay. Nicole, do you want to introduce yourself?
Good evening. I'm Nicole Martin. I'm the director of the Office of Community Living, and we oversee some of the waiver programs.
Wonderful. Am I missing anyone? Let me know. Didn't see Bill, didn't see Ann. I think that's everybody. Okay, I think that's everybody. With that said, we'll go ahead and jump right into questions. And the first one that I have is, could you, and this is probably a Victor question, could you explain the timeline for receiving renewal packets, how long they have to complete them, if they're going to be in danger of losing that coverage, how much notice they'll receive, and then what's the grace period if they've lost coverage?
Well, we're going to use the standard renewal processes that we do we have for years. And that is when the renewal packet comes out, the expectation is it should come back within 30 days. And then the worker has 30 days to process to the renewal. If they're denied for, and probably the most often, the biggest thing people get denied for is failure. We call it failure to provide. There's documents or verifications that are needed. We can't get those electronically. And especially with, since these are home health care agencies, a lot of these people are the members will be ABD. So we may be needing now new resources to get those updated. So if they're denied, there is a period of time to allow them a grace period to get that information in. So we don't want to have any people being denied and then having to reapply.
And Victor, what is the time period for the grace period? Is it 60 days, 90 days?
Yeah, it's a 60-day period.
60 days, okay. And a follow-up question, not to that one, but along the same lines is, does the renewal process differ for recipients who have turned 18 since their last renewal before COVID-19?
Could you repeat that question again?
Yes, does the renewal process differ for recipients who have turned 18 since their last renewal? Like
No,
before COVID, and then during COVID, they became an adult. And what's that process look like? And what's the difference? That's the question.
Every member is going to have to renew. So if they were 16 when they were last renewed, let's say in 2021 or 2020, now they're 19 or 20 years old, they're going to have to renew. And those are especially important that we get their information because more than likely their what we call aid categories, what coverage they're eligible for, has probably changed. So there's really no one that is not going to be touched or renewed or have their case reviewed.
Awesome. Another question, and this may be open to all of our SMAs, but what documents may be requested when renewing and reviewing for the renewal process? What different things should those community members be on the lookout for?
You want me to take that one,
Go
Natalie?
for it, Victor. Yeah.
Yeah, as was mentioned before, during March, we're going to do what's called ex parte or no touch processing, which the worker will attempt to gather information electronically. Since we're talking here to home health agencies, probably most of these members will be age blind or disabled. So if their renewal is sent to them, probably the biggest things will be income that we can't get electronically. Like we can get most Social Security income electronically, but if they are receiving a pension or they have earned or other unearned income where we can't gather that, like through the work number or electronic processes, they'll be asked for that income. The other big one is going to be resources. So those are things like financial resources such as their bank accounts or credit union accounts, life insurance with cash value, vehicles, so any of the resources that they've had before. And that's probably going to be the biggest challenges. Members haven't had renewals in 3 years, and we know a lot of things will have changed, and they might not be sure what they need to provide. So we've been telling everyone, be on the lookout. If you get a renewal, make sure you read it over. If you have questions, ask, but make sure that you do return the necessary information so they're not denied and coverage closes.
Awesome. This may be a Tia question, but will MCO care coordinators or case managers be equipped with all the resources that they need in order to support members during this process? And if they will be equipped, what are some of the things that they should be on the lookout to access?
I think it could be, I can start answering, and then if Nicole Martin hears me not give enough information, she will chime in. But the answer to that question is yes. We are currently partnering and coordinating with our managed care plans to ensure that they have informational packets, so to speak, across the board. So they'll have the tools that they need to make sure that they're there to support the members and provide correct direction and obviously assistance in this process. Nicole, is there anything else that you wanted to add?
No, Tia, I think you covered it. Thanks.
All right. So another question would be how, so I don't know if this is applicable to right now, but maybe more of a question that could be answered through one of the resources on our website. But if you are a home health agency, how can you get referred clients during this time? Is that information they can find on our website somewhere?
This is Nicole. Yeah, so if you're a home health agency, and you are looking for clients, make sure that your local social services has your information. So when they are doing screenings, they know that you are an available provider.
Awesome. And another follow-up to that would be how are home health agencies able to connect with social workers and case managers as they're navigating this renewal process time period?
I can speak to the care coordinators, case managers, if you're the members that you are providing services to have either a support coordinator on the DD side or a care coordinator with the managed care organizations, you should be able to have the information for who that person is. I don't have the specific information on how you find that out, but we'll put that information on the website when we put all the questions together. But there is a way for you to know who their care coordinators are.
Okay, I couldn't cut off mute. So for the different waivers, how will they go? Where will they go to find more information about which ones will be in place, stay in place, which ones will be shifting and changing due to this renewal process, if that's the case at all? And then who would they connect with to ask more in-depth questions about those different waivers?
So the waivers aren't changing as a result of this process. So, the only thing that may happen is if the person is no longer eligible for Medicaid, then there might be a change for their eligibility, but the waivers are not impacted directly by this eligibility renewal process.
Follow-up, will it be impacted by the ending of the public health emergency in May?
So when the public health emergency ends, there are a couple flexibilities that are still out there that we are doing. They will not go away until 6 months after the end of the public health emergency, which is November. We'll put out a lot of information about that before those flexibilities end.
All right, so will redeterminations affect those who are currently in, well, I don't know if this is applicable anymore, Medallion 4 and CCC Plus, in the same way, or is it going to be differently? Does anyone want to take that question on?
Sorry, repeat the question again, Natalie.
Will the redetermination affect CCC Plus programs or Medallion 4 programs in the same way? Do they need to check the redetermination for those individual plans separately? And I don't know if that's still, well, yeah, it's a question.
So the eligibility is applicable to any Medicaid member. It's not program driven. So let me just try to find the best way. When eligibility is determined, you are assigned a program. So there is a possibility if the member currently has CCC Plus or Medallion 4 that they may be affected by this process. We're looking at Medicaid population as a whole and not by individual program type. Does that answer the question?
I think so. And if that person is here,
Okay.
they can definitely submit an additional follow-up question if it didn't.
Okay, thank you.
So you're welcome. Not a follow-up, but a separate question was, will the billing process change if someone is deemed to be ineligible in the middle of this process? So how would the billing process change for those who are found to be ineligible?
The changes to the billing process will be that if the patient is ineligible, then obviously you wouldn't be able to receive payment for those services. So as far as how you currently bill us today, that won't change. The process in which you deem someone to be eligible for Medicaid, today you probably are checking eligibility, but I'm sure providers and billers have gotten confident with the fact that most members' eligibility has not changed. Going forward, you must just make sure that you check the eligibility of the member. As far as the billing guidelines that are in place, those will remain. But obviously, if the person loses their eligibility, then, reductions or change in coverage will happen. Keep in mind, most people are made eligible for Medicaid on a month-to-month basis, and Victor can correct me on that. So if you're worried that services are being rendered and you verified that Tia Lewis had coverage for the month of June and you bill June, more than likely, unless there's a life-changing event, that person's coverage will remain in effect for that month that you intend to bill.
Sorry, I was trying to pull pull a question and I couldn't see it. So,
Can I ask a question?
oh, you can submit it in writing.
Okay.
Sure. Yeah, it's easier for us to pull it that way so we can make sure we keep up with the questioning of itself. The so okay, here it is. Can a parent still work for their children as a caregiver? Would that change any for the redetermination process? And I don't know about the workforce. I don't know if that question can be answered here, but the first one, yes.
Yeah, so this doesn't impact, well, let me rephrase. Parents are able to continue to provide reimbursed care for their children through November. It is a flexibility. We are working toward making this permanent. We are working with CMS on what needs to happen as in the way of the rules for parents to continue this. But yes, definitely all the way through November 11th.
And redeterminations, and this is a Victor question, applies to all covered groups, includes children and adults alike, correct?
Yes, that's true.
All right. And are there any covered groups that this process will not touch or will not impact?
If
I
someone
can't
is,
think, go ahead.
I'm sorry. I just was thinking, right off the top of my head, if someone is pregnant, then they get coverage without a renewal. You're not allowed to decrease their coverage once they're determined eligible as pregnant. And then they get postnatal coverage for a set period of time.
Okay. And Victor, did you want to piggyback that or that?
No, that's Katie nailed it.
Okay. And this is a Katie question. Any suggestions for or guidance as they navigate connecting with LDSS staff person?
Why that question? That being said, if someone is having issues connecting with the local agency assigned worker, I've been putting it out there that if you are calling on their behalf, just know that without a consent to release information, the local agency can't give you any information because we can't break HIPAA code because that is personal information. If they're trying to call and they are not successful, then what I would suggest is perhaps they can contact Cover Virginia. Cover Virginia will send local agencies memos that get downloaded. Also reach out, and I hate to say this, but if they can't reach the worker or the worker's not returning their call, then ask for their supervisor. I hate to say that because I've been a supervisor and I don't like getting those calls, but I like to know when people aren't returning calls. So, I mean, that's the best I can say. A lot of agencies also have where the workers are available by email, but same thing will apply. If you're calling me regarding an individual that's enrolled in Medicaid, I need to know that I'm allowed to speak to you or to give you information. So just keep that in mind.
And I don't know who can answer this question, but where would they find information on how to become an authorized representative?
That's actually pretty easy. It doesn't have to be anything fancy. I could handwrite a statement and say, I authorize Victor Grand to be my authorized representative for purposes of applying for Medicaid. You can also be a power of attorney. There's a page on the actual application. If you go to the Cover Virginia website, and I can't remember what appendix it is, there's a page where an individual can indicate who they want to be their authorized rep. We usually would get those from application assisters that are out there, but that would be applicable too if somebody just wanted to designate one of their providers or someone else. They could use that as a tool to be an authorized representative. The agency just wants something knowing that they're allowed to speak to you and not break HIPAA rules.
Awesome. I think that covers all of our questions thus far anyway. You know how we like to get them while we're doing wrap-up statements. And so I'll turn to each one of our subject matter experts, and I like to make sure they have, if they have any takeaways, that they give an opportunity to give them. And so I'll start with Nicole Martin. Nicole, do you have any takeaways for our group today that you want them to make sure they leave with an understanding of?
Yeah, I think the most important thing is checking eligibility prior to providing services at the beginning of the month, like we've been saying. I think that's going to be really important for you to make sure that you are able to bill for the services that you're providing. And it also gives you a clue on whether or not there is an issue with the individual if they haven't returned a packet. So you can provide some support there. But checking eligibility is one of the number one things that we will like for you to continue to do.
All right, Tia, do you have any additional takeaways?
No, I don't. I agree with Nicole's takeaway. For me, that's the most important aspect, is checking eligibility.
Awesome. And what about you, Victor?
Yeah, I posed it as a question, and that is, you may run across members whose patient pay has increased. What the policy was during the public health emergency is if patient pay had been reduced, it was not to be increased. We know we've had, COLA increases, income increases, changes in households. People have moved from facilities or from home to facilities. So patient pays, we know, may have changed. And if they have questions, they do need to reach out to their local worker, and as Katie mentioned, or to the supervisor.
Awesome. Katie, do you have a takeaway that you want to leave everybody with?
My biggest takeaway, and I've perfected this now on our fourth or fifth session, is when you're talking to the individuals that are your patients or customers, please make sure you advise them to look at their mail. Look to see if they're getting any mail from Cover Virginia, who might be handling their case, or the local agency, or DMAS. If someone doesn't go through the ex parte renewal process, which for this group would be the age, blind, and disabled, and there is a resource test, so they're not going to go ex parte and be automated unless they're an SSI individual with no countable resources. They may get a checklist asking for verifications. Make sure that they look at the checklist to see what they need to return. It's very important that they look at their mail. So in conjunction with that, see, I brought that word back in. If you are a provider, please make sure that you have submitted a DMAS 225 to the agency to indicate that the person started care. Over the past 3 years, agencies have enrolled people based off of a screening for care. And generally, we would give them 30 days once we've enrolled them, and then we would reevaluate them if they didn't have a provider. So in that 3 years, maybe a 225 was sent, maybe it wasn't. But make sure that a 225 has been sent if you have someone that's in your care. Because when they start doing renewals, the local agencies are going to have to do some research to see if someone is receiving care under the long-term services and support categories, and if they have a current provider. So that's my most important thing.
Thank you. And as always, they sneak in a couple more questions as we get to the end. So one is, will electronic signatures still be accepted and collected after?
I can speak on that because I know we've been having conversation on our end.
Mm-hmm.
One of my teammates went to a meeting at DMAS, and they are trying to work with CMS to get them to allow to continue the verbal authorization, or that form that I know they're referring to. I can't think of the official name, but they haven't gotten it officially. So they are working on that, but there hasn't been a decision yet.
All right. And then will you say, I think this is more of a niche question, so I think we're going to add that to our FAQs. And this one is, let's see. Okay. For parents, are they able to utilize both respite and personal care hours if the person is still deemed eligible?
If we're talking about parents being reimbursed, then parents can only be reimbursed for personal care, not respite.
Thank you, Nicole. And got that one in, got that one in, got that one in, got that one in. I think I got them all. Okay, so, all right. So we first and foremost, thank you all so much for all that you do, all that you continue to do, all the help you continue to provide to all of our members. I absolutely understand and know that for you, it is frontline work. We know sometimes it could be thankless, but we see you, we understand, we hope that you're empowered, that you have the resources that you need in order to do the hard work that's necessary. Our directors, the Commissioner Vula, as well as the Director Roberts, often will say, and they both understand that at the end of the day, the most important component and factor to all of this work is our members, and providing that quality care through your work is really important. So however we can help you is contributing to that process. So we thank you this evening. Please attend any other ones that you deem necessary. Submit any additional questions that you may have through Cover Virginia at dmas.virginia.gov. And we hope to see you soon. And if you have any parting words or feedback that you want to drop in the chat, please do so on your way out. But we thank you for the evening, and please have a wonderful one. We want to make sure we got you out of here in an hour. So thank you again, all of our subject matter experts as always, and all of our behind the scenes staff and team members for helping today. All right, y'all have a good one.